What if I told you that some of the most commonly recommended medical tests for older adults could actually do more harm than good? It sounds surprising, but the reality is, when it comes to aging, less can sometimes be more. Hi there, I'm Harold Hal Kimura, host of Aging Boldly for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around aging and wellness. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Everything I share here has been reviewed and approved by our Ubi medical team. Let's talk about a subject that doesn't get nearly enough attention: the potential downside of routine health screenings for those of us over 70. Now, don't get me wrong, regular checkups have their place. But there's a shift happening in how experts view testing in our later years, and it's something everyone over 70 should know about. Take colonoscopies, for example. For decades, they've been considered a gold standard in cancer prevention. But after 70, especially if you've had clear results in the past, the risks of the procedure can start to outweigh the benefits. I've known folks who went in for a just-in-case colonoscopy and came out with dehydration, confusion from anesthesia, or even injuries from post-procedure falls. One friend, Walt, 82, spry, generally healthy, had his colonoscopy, fell on the way to the bathroom that night, and spent 3 months recovering from a broken hip. The kicker? Nothing was found in the test. Instead, many doctors now offer non-invasive at-home stool tests, like the FIT test every year. They're simpler, gentler on the body, and still effective at flagging warning signs. And that might mean staying healthy without the hospital gowns and the risk. Another one that raises eyebrows? Full body scans. They sound great, like you're catching diseases before they begin. But in practice, for seniors, they sometimes open up a can of worms. These scans often detect harmless abnormalities that trigger a flurry of follow-ups, biopsies, or even surgeries. I once met a woman named Caroline at a community wellness event, 76 years old and feeling fine. She got a low-cost scan on a whim and ended up going through surgery for a tiny kidney spot that her doctor later said probably would never have impacted her life or her health. What started as an attempt to get peace of mind became a months-long cycle of anxiety and recovery. That's called overdiagnosis, and it's very real. Now, what about stress tests for the heart? They've been standard for decades, especially if there's any concern about cardiovascular health. But here's the twist. If you're not having symptoms like chest pain or unexplained shortness of breath, today's leading cardiologists suggest that those tests may not be useful past 70. In fact, they often flag normal age-related changes as problems, setting off an expensive and potentially dangerous cascade of further tests and treatments. I knew a retired teacher named Al, 74. No symptoms, very active. His doctor ran a routine stress test just to be safe. That led to a catheterization and eventually a stent, none of which may have been necessary. He ended up with complications from blood thinners, landed in the ICU, and took nearly half a year to recover. He told me later, "I went in feeling great. If only I had said no." This isn't about avoiding care. It's about making care thoughtful and aligned with how you want to age. After all, the goal isn't just to live longer, it's to live better. So what do we do about all this? First, only say yes to tests that genuinely make sense for your health history and current symptoms. If you're symptom-free and have a history of good results, don't be afraid to ask, is this test really necessary at my age? Second, choose screening alternatives that are less invasive. Those at-home stool tests, they're a great place to start when colon screening is needed. Feeling unsure about your heart? A conversation about your daily function may be more telling than a treadmill test. And finally, listen to your body. If you do have unusual symptoms, like blood in your stool, chest pressure, unexplained fatigue, absolutely tell your doctor. In those cases, further testing might be exactly what you need. But when tests are being done just in case, it's okay to press pause and reconsider. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from Ubi Health. Stay informed, stay health-wise, and until next time, keep aging boldly.